Thanks, Cormac, and welcome back everyone to the afternoon session of the Response Closing Conference. We're going to be starting back with a panel on rights-based education and employment for persons with disabilities in times of emergency. And we're delighted to welcome our chair for this session, Theodore Mladenov. I'll just briefly introduce Theodore and then I will hand over to him for chairing the session. Theodore is Senior Lecturer at the School of Humanities, Social Sciences and Law at the University of Dundee. Previously, he was Marie Curie Individual Fellow at the European Network on Independent Living and was also a Leverhulme Early Career Fellow at the Centre for Public Policy Research at King's College London. He has expertise in disability studies, international social policy, post-socialism and critical theory. And he is the author of Critical Theory and Disability, a Phenomenological Approach, and also of Disability and Post-Socialism, both of those more recently published in the last few years. In the period 2000 to 2009, Theodore was actively involved in campaigning for disability rights in Bulgaria. So I'm delighted to hand over to Theodore to chair this session, and we're very much looking forward to hearing the speakers around education and employment.
Thank you, Suzanne. So it's my pleasure to be here, to be able to be involved in this important work and to chair this session. I would just want to say that issues around COVID have been so quickly forgotten that it's good to be reminded of what happened during the peak of the pandemic and what happened to disabled people and with disabled people at that time. Before the lunch break, we heard about healthcare. It seems that healthcare has been a hotspot, but issues related to education and to employment have also been very important, particularly for disabled people living in the community. From the work that our colleagues at Galway have done, we can see that the negatives here have been great indeed, as the negatives, as the barriers, as the injustices in healthcare. We have observed the breakdown of existing supports of different kinds, inability or reluctance to provide accommodation. Many disabled people lost their jobs, DPOs filled gaps left by public authorities, by public provision. But there were also some positive things, and our speakers today will perhaps also mention them, particularly with regard to remote opportunities to learn, remote opportunities to work. And as we see now, Zoom, Microsoft Teams have become very much part of our everyday living, and many disabled people find this enabling, although I don't want to imply that we should be overly optimistic about this, about the way in which technology has permeated our lives post-COVID. But without further ado, I would like to invite our first speaker for this session, Elaine Greene, from the Irish Deaf Society. Hello, Elaine. And I'll try to make a sound or a sign when your time is about to end, but otherwise I'll keep quiet.
Just do 2. You can do 3, 2, 1.
Okay, good. I will.
Good goes. Do I start? Yes? Good goes. I will sign at speed so that I can condense all of the information in 15 minutes. My name is Elaine Grehan, but I have a particular name sign that indicates curly hair because I do have curly hair. I am a deaf woman. I have curly hair. There are several interpreters here because I'm using ISL, also going into English, and it's also going into international sign. For those that need to have a visual description, I am a woman, short curly hair with glasses, mid-40s, silver white hair, wine glasses, red blouse. I'm also wearing long leafy earrings. I am a white person. Today, I am representing the Irish Deaf Society, a unique deaf-led organisation and one of the DPO colleagues here in Ireland. My role is that of an advocacy manager, and it's about empowering deaf people to recognise discrimination, to promote equality and equity, as well as inclusion in our work, and building bridges between deaf and public and private services. And for us, information is not accessible, so therefore deaf people are always excluded, isolated and marginalised. I'd like to thank the Research Response for inviting me to this panel. I will focus on the theme of employment and education for people with disabilities through COVID. That is the conference, but I will target my attention to the deaf community. I apologise, I do not have a PowerPoint. I am reading from my notes, but should you wish to have a copy of my notes, I'm happy to share that with you. The information that I have received are from deaf people, hearing educators, but because of short of time, I will try and pick out the most salient information that I can provide you in 15 minutes. The biggest issue for us is the use of Irish Sign Language. Now, the world is dominated by sound and hearing sound. That is the world at large. Now, COVID-19 highlighted how deaf people have experiences, challenges and barriers to access education and employment, especially during the period of the emergency that we had. Communication was the biggest barrier. No accommodations made for ISL. There was a need for deaf people to be involved in society. That did not happen. So looking at the challenges of deaf people and the experiences that they had during COVID in the area of education and employment, it happened elsewhere, but I'm just going to focus on education and employment, looking at the negatives, looking at the positives, the improvements that have been made, and how deaf people are becoming more included. For us as deaf people and using the human rights-based approach to education and employment, now everyone, including deaf people, needed information, but it was not always there for deaf people because it was not used in ISN. Now, for people that needed to understand, we needed full information like anyone else did in the world. What we were dealing with was the education and employment needing to do that for us. Now, we looked at adapting it to remote. Many businesses, factories were obviously impacted and were closed down or let go of staff. Deaf people had the additional barrier of knowing when all of that was going to happen. The wearing of the masks was one of the biggest challenges for deaf people in education and employment. Deaf people found it difficult to communicate with any teachers, peers with the use of masks because masks covered facial expressions, lip reading, making it very difficult for those that relied on lip reading. That caused miscommunications, misunderstanding, because there's no way of seeing the facial expressions, the lip patterns, and those are essential elements of non-verbal communication for deaf people. And that would have reduced communication by 70 to 80%, making it very difficult for deaf people to talk to educational colleagues, employment colleagues, and affected their ability to be involved and with their colleagues. Deaf people felt socially isolated because of the wearing of the mask and no communication. This applied to deaf children, deaf students that were dealing with additional barriers to education because they could not fully get involved, did not understand what was happening in the classroom because of the wearing of the masks. Deaf children and students experienced huge challenges remotely as well. Deaf children struggled with understanding what was being said, what was being signed remotely because of poor quality or broadband quality or restrictions of space on the computer. Deaf children were unable to engage with their friends the same way as they would have done in person, where they learned from each other. So they experienced social exclusion and isolation. Most people relied on online learning platforms in lieu of classrooms, but for deaf students, they experienced access to technology, not having the tools, not having the internet connection to be able to be involved in their classroom. Now, everyone, including deaf people, felt stress, anxiety, but for those who are deaf, had the additional anxiety because of communication barriers, how to access information, what accommodations would be made. Looking at the education programme here in Ireland, we've got a national TV channel called RTE, and during the pandemic here in Ireland, they provided the opportunity to watch specialist education programmes on television, but were not accessible to deaf children. So they were treated differently to other students. RTE, when they first provided the programmes for primary school teachers, was successful, but without ISL interpreters, and deaf children could not engage with the lessons. The Irish Deaf Society had to lobby and work with RTE to ensure that there was ISL provided for those programs. They were willing to do so, but at a much later stage. But it was us having to remind them, to work with them. They didn't automatically include us without us saying it to them. The RTE program had one program per day for deaf children. That program was not available at the same time or on the same channel as hearing students. For example, hearing students programs would be shown at 10 o'clock on RTE, which is a popular channel here in Ireland, while deaf program was extended to 1 o'clock on a different channel called RTE News Now. So it was the same program shown differently on different channels. So it just goes to show that deaf children were unable to watch the programs with their hearing siblings, because if they were sat there at 10 o'clock, they would not have access. So it caused a separation. When remote classes became the norm for all of us, but deaf children did not have the resources, the technology, or specialist staff that could cater for deaf students. Deaf children's parents made mention that there was no equitable opportunities for deaf children in the education system and would be unable to have academic success. So they were marginalized and limited. When the hearing schools opened, the deaf schools did not open until much later. Deaf children and their families experienced struggles with communication because of the language barriers. Again, another challenge. Deaf children use ISL, which may be different to the language of the family. So it became a language barrier and more difficult for the family to be able to communicate with their child. Family members were unable to understand or have the experience of having deaf children, leading to frustration in communications. And again, challenging for families who had never heard of the deaf community or unaware of their language and their culture. Some families did not have access to the right appropriate technology or resources to be able to support their young children with the use of ISL interpreters. So it made it very difficult in terms of communication, and again, leading to isolation and frustration. Hearing and deaf children from other countries, such as the Ukraine, Syria, Bosnia, and other East European countries, English would be their second, third language. So again, they also faced additional barriers. So that's education. Now, with any economic or pandemic situation, it will cause an impact on employment for all people, as well as deaf people. So we're now talking about employment. And again, communication made it difficult for deaf people, missing out on information, critical information in relation to work, to changes, to work schedules, to health protocols, emergency procedures, all of that. And in some situations, job opportunities were reduced because of the pandemic and led to people being let go or closed down. So that meant that deaf people had already experienced barriers and challenges, but now are limited to opportunities to education and work. Deaf people have the additional communication barrier and access to information, making it very difficult for deaf people to work with their work colleagues and show their competency and to be able to perform well in their jobs. Now, within an emergency situation, it is difficult for everyone, including deaf people, but however, there was positives. There was a high demand for clear communication, more awareness and understanding of ISL and deaf culture, and there was technology that became accessible for deaf people, such as remote interpreting, and other accommodations were made and became more widely available, allowing for more easier access to communication. The community were able to support each other, advocate on each other's behalf, improve access, inclusion through the emergency, the sending out of information, and improving the emergency plan. Deaf people were able to adapt and become creative in new communication methodologies, coping strategies, and after that have managed to cope quite well. Now, we did ask deaf people, why did they like to work from home? And we received similar feedback. They liked remote communication because they were less obligated, less burdened with communication within the office space, so they could be productive at work without being at work. Deaf people found it easier to work from home because they had a more accessible environment. Digital communication came into play, easier to communicate with colleagues, because in the office they would say there is no interpreter, but however, through technology, it could happen. But it is important to remember that not all deaf people want to work from home. Some deaf people prefer to go back into the office. Deaf children were very keen to go back to school in comparison to the hearing counterparts because they wanted to be able to communicate with their peers through Irish Sign Language again. What is important is access to information and updated information, but deaf people were stuck within the community and they were unable to get that kind of access that they normally would have done. So I'm going to jump now to the conclusion. There were commonalities: lack of access to information, the lack of use of ISL, the challenging experiences faced by deaf people in education, employment, and other areas. But there was improved access, but there is a lot more work to be done. Everything is not okay. It needs to be continued to have equality and equitable opportunities. There are room for positive change: remote learning, remote working, the value of having more access to ISL interpreters, promoting diversity and inclusion within society. All of those have proven important. There are concerns. Prior to the pandemic, there were policies and procedures in place. We had the UNCRPD. The pandemic turned that upside down. So now we're restarting all of our work today. Now, today, as an example, a parent's right of a 14-year-old deaf boy have been challenged in the High Court about wanting the use of ISL interpreters, lobbied for 10 years. Today, it announced in the national newspaper that the court have awarded the son full access to an ISL interpreter in the classroom. But it just goes to show that it's the parents that have to do the fight. But think about all of those parents that do not have that resource. But we have to lobby. The government is obligated, and they're obligated to the UNCRPD. I know that I have gone at an incredible pace, but that's it in conclusion.
Thank you, Elaine. That was very informative and very critical as well, which I think we all have to be looking back at what happened during the lockdowns. And your emphasis on communicative barriers was very clear. And finishing with a positive story also made a difference. So our next speaker is Paolo Addis from St. Anna's School of Advanced Studies in Italy. So Paolo, hello.
Hi,
the floor is yours.
Good afternoon, everyone, and thank you for having me. I am very happy to be here and to contribute to this final event of such interesting project. My intervention is divided in three parts. First of all, I will describe briefly the impact of COVID-19 spreading on the Italian legal framework. Then I will analyze the impact of a pandemic on the right to labor and on the right to education of persons with disabilities. Finally, I will give some final remarks, trying to develop some considerations de jure condendo. In the first quarter of 2020, Italy was hit very hard by COVID-19 pandemic. Some factors could explain that. Italy has the most elderly population in Europe and the second most elderly population in the world after Japan. Moreover, the proportion of people infected were very high in some specific areas that were highly infected. So the sudden burden of cases of patients overwhelmed the healthcare system capacities. So the Italian government declared a state of national emergency in January 2020, and in March 2020, the Italian executive adopted stringent lockdown measures using a specific normative power provided by Article 77 of Italian Constitution, which states that the government, in case of necessity and urgence, may adopt under its own responsibility temporary measures having force of law. So emergency measures were adopted also with a long series of decrees of the president or the council or the ministers. Our legal scholarship debated for months about the chain of validity of such provisions, and some constitutional law scholars have speculated that such use of normative tools by the government, favored by pandemic, was on the edge of inconstitutionality. Moreover, lockdown measures limited some constitutional guaranteed rights and fueled conflicts between states and regions. Having regards to the legal condition of persons with disabilities, Marisa D'Amico pointed out that firstly, the political and public debate overlooked the intersection between COVID-19 and disabilities. We are in this situation altogether, a kind of we are all in the same boat rhetoric. The asymmetrical character of containment measures. It took weeks to understand that persons with disabilities did face a greater risk than the rest of population, because in many cases they were abandoned to solitude, and the interruption of social services, the exclusion from information about health situation, the limitation of constitutional freedoms undermined persons with disabilities dignity. So what to say about the right to labor? Preliminarily, it has to be noted that from a constitutional perspective, labor and the right to labor has a foundational value. Article 1 of the Italian Constitution solemnly declares that Italy is a democratic republic founded on labor, and in the past, the idea of disability was founded on the concept of inability to work on the basis of Article 38 of the Constitution. As in other countries with a similar economic and productive system, Italy adopted smart working as an instrument for reconciliating the right to health and the right to work. Persons with severe disabilities, as well as workers with a person with disabilities in their family, persons with weakened immune system, persons with oncological pathologies, and persons carrying out life-saving therapies had the right to working from home if possible. In private companies, persons with disabilities had a priority lane for smart working, and in a general way, smart working has been considered a reasonable accommodation. But as remarked by some DPO, many persons with disabilities reported that they did not have access to smart working. Once again, an apparently neutral measure revealed a discriminatory phase. Moreover, it has to be noted that during the pandemic, mechanisms of mandatory hiring imposed by law number 68 of 1999 were suspended. And so it's not surprising that a report published by INAP in 2021 put into evidence that in the first semester of 2020, just 50 persons with disabilities were hired in the whole country. Before COVID-19, data available on the right of labor of persons with disabilities were not encouraging. Greater efforts are required for the future. Now, let's examine the right to education. I have to make some preliminary remarks. Italy has a long tradition of educational inclusion, and some scholars indicated Italy has a case to follow towards compliance with Article 24 of UNCRPD. Italy's policy of school inclusion started in the 70s, and in the following years, the integrazione scolastica became a leverage for a more inclusive approach in many other areas of life. How did the pandemic-related measures impact on the right to inclusive education? The Italian school system, since March 2020 until April 2022, adopted e-learning in Italian didattica a distanza, DAD or DAD, as a general tool to guarantee the right to education, balancing it with the right to collective health provided by Article 32 of Italian Constitution. Italian DPO underlined immediately that e-learning did pose several problems for pupils with disabilities. First of all, with regards to accessibility issues. Moreover, digital divide is still a huge issue in Italy. Past the most difficult phase of pandemics, situation changed. Since school year 2020-2021, ministerial guidelines recommended a moderate use of distance learning. Law Decree 111 of 2021 made possible the didattica a distanza just in exceptional cases, and recommended, even in such circumstances, face-to-face teaching from persons with disabilities. As underlined elsewhere, this provision imposed a different treatment for people with disabilities. In some cases, children with disabilities spend their time in empty classrooms, just with their teachers. In such situation, the right to inclusive education lost its relational traits. ISTAT data emphasized that severity of impairment represented the main cause of exclusion from distance learning, followed by social and economic conditions, organizational difficulties, and the lack of adequate technological tools. Less frequent reasons include the difficulty to conciliate e-learning and the individualized educational plan, and the lack of specific teaching aids. Finally, it has to be noted that the Italian school system has some long-term flaws. School facilities are still largely inaccessible. So I'm going to conclude my intervention quickly, and I have some final remarks. After pandemic, Italy received an impressive amount of financial resources from Europe, and the National Recovery and Resilience Plan contains some provision dedicated to persons with disabilities. In December 2021, the Italian Parliament passed a delegation law bill having a potential big impact on the rights of persons with disabilities, but the government did not still exercise its delegated legislative power. So finally, did Italy learn something from the pandemic? Well, I don't have a clear answer, but I am afraid that our legal system is not still compliant with Article 11 of the United Nations Convention on the Rights of Persons with Disabilities. As an example, Italy is the second largest donor of the United Nations Focal Point for Disaster Risk Reduction, but I have serious doubts about the inclusivity of the Italian emergency network and the compliance of Italy with the Sendai framework, framework for disaster risk reduction. And so my intervention is over, Theodore, and I will give you back the microphone.
Thank you, Paolo. Very good time management. Thank you for these reflections on the situation in Italy. And I'm sure we can see a lot of overlaps with the situation in other countries. And what's interesting with Italy is that it's a leader in inclusive education. And it was very interesting to hear the problems with distance learning in this particular context, in the context of a country with such a strong tradition in inclusive education. And now we are going to hear about the issues in Sweden, another model country with regards to disability policy. So I have the pleasure to invite Monica McGrath from the Swedish Disability Rights Federation. So the floor is yours, Monica.
Thank you very much, Theodore. Good afternoon, everyone. My name is Monica McGrath, and I work as a communications director and interest policy investigator, I think that's what it's called, at the Swedish Disability Rights Federation. And just like Elaine, I have curly hair, but my hair is dark and partly gray. I am still 60 years old, and my beautiful surname McGrath comes from my Irish husband, whose name is Cormac. I want to start by saying congratulations to the response team for your interesting and very important study and report. And I want to express my admiration for the arrangement of this conference. It has been both disheartening and inspiring. Thank you so much also for inviting us to participate here today. I will start by telling you a few words about the Swedish Disability Rights Federation, and then I will talk shortly about the general experiences in Sweden regarding the effects of the pandemic. And from that, I will go on and talk a bit longer about the effects in Sweden on education, and finally about the consequences on the labor market for people with disabilities. The Swedish Disability Rights Federation is the united voice of the Swedish disability movement. We were founded in 1942, and we are an umbrella organization for 50 national disability organizations that together represent about 400,000 individual members. We also act as a referral body in relation to the government, the parliament, and national authorities. Our vision is a society for all, characterized by solidarity, equality, and participation. And our goals are, of course, based on the CRPD. We are also a member of the European Disability Forum, and because Sweden holds the presidency of the European Council for the first half of 2023, we just recently held an international conference in Stockholm together with EDF. And then the subject was AI and how the very rapid development of AI can have a negative impact on the inclusion of people with disabilities. But now to today's subject. No previous event in Sweden has received as much attention abroad as how we handled the pandemic. The narrative that it was business as usual in Sweden was common during the spring 2020, and Sweden was described as an exception from the rest of the world. One area that was highlighted was the Swedish governance, with the authorities' independent role towards the government. We were talking about the public health perspective in Sweden here in the morning, and that the public health authority, they had a really independent role in creating recommendations and advice during the pandemic. At times during the spring of 2020, Sweden had death rates that were among the highest in Europe. The infection spread to residential care facilities for older people. Some people did not get proper medical care. The guidelines had the effect that older people sometimes did not receive the hospital treatment that could have helped them. And many people died with no family member or any other person by their side. Eventually, Sweden came through the intensive part of the pandemic relatively well, as one of the countries with the lowest excess mortality over the period 2021. More than 15,000 people, though, died in Sweden from COVID-19. The focus on advice and recommendations, which people were expected to follow voluntarily, put a strong emphasis on the individual's own responsibility to take precautionary measures to limit the spread of the virus and to protect themselves, of course. And one main problem concerned the lack of accessible information that some of you already have touched upon today. The lack of accessible information about the virus and the recommendations were very problematic in the beginning. Every day a press conference was held, but it was only after the disability rights movement drew attention to the shortcomings in accessibility that sign language interpreters was brought in, for example. And there was the same situation, the same problem with written information on, for example, the authority's website, for example, the Public Health Authority, where there was a lack of information in inaccessible formats, such as updated information in an easy to read format. I think they just published one text in the easy to read format, and that stayed the same for almost 2 years. In April 2021, the National Board of Health and Welfare presented shocking statistics regarding the death toll among individuals in housing with special services for adults with disabilities. Out of 3,500 people who had been infected with the virus, 149 died, which corresponds to the staggering 4%, the double the percentage of the general population. The high number of deaths can be explained, among other things, by the fact that many of the individuals were in so-called risk groups, but also because the staff at the facilities had inadequate knowledge of both infection risks and which symptoms could be serious. So this was a clear violation of Article 11 in the CRPD. Measures were not taken to fully protect people with disabilities from the infection. And one lesson learned that is also expressed by the Swedish Corona Commission is that the absence of a plan to protect at-risk groups earlier and additional steps should have been taken to try to slow community transmission of the virus. The Swedish National Association for People with Intellectual Disabilities, which are one of our member organizations, they conducted a survey study during 2021. Based on the results, the organization states that no other group in society has been hit as hard by the pandemic as adults with intellectual disabilities. In addition to national general recommendations and advice, individuals was also affected by visitation bans, closed common areas in housing with special services, closed daily activities, and cancelled events. And the digital exclusion among people with intellectual disabilities worsened during the pandemic. It was really bad before, but it became worse. Half of those who responded to this survey did not have the opportunity at all for digital contacts during the pandemic or during the intense part of the pandemic. Yes. And now over to school and education. From March until May 2020, all European countries except Sweden suspended in-person contact in school at primary, secondary, and tertiary levels. But in Sweden, primary schools were never closed. Secondary schools were closed in some regions, but during very short periods of time. Regarding upper secondary school, however, Sweden was more similar to the rest of Europe. School was closed to and from between March 20 and January 21. Most upper secondary schools for students with intellectual disabilities never closed down. Almost all upper secondary schools exempted students in need of special support, in need of extra adjustment, or for social reasons. So there was an exclusive part here that students came to empty classrooms, of course, and were taught in an empty classroom with a teacher. Special schools for students who are deaf or have a hearing impairment, severe language disorder, or visual impairment in combination with other disabilities, they were open during the whole pandemic. Even before the pandemic, there were significant challenges for schools to fulfill their compensatory mission. Issues such as inclusion, assessments of support needs, personnel resources, special education expertise, and the ability to provide adequate support to students with disabilities within the regular school system are central policy issues that the Swedish Disability Rights Federation work with a lot. And the Swedish Agency for Participation mapping, they did a mapping, and that shows that the major changes in the education sector during the pandemic have led to a deterioration of the school situation for many children and young people with disabilities. And the National Agency for Special Needs Education and Schools, they share the same view. The challenges lies within two areas: missing education and distance learning. Absenteeism and workload among school staff, teachers in elementary school affected students' teaching, learning, and well-being, and have led to deficiencies in schools' ability to maintain quality in special support. The respondents in the Swedish Schools Inspectorate's report highlights that the high staff absenteeism has led to deficiencies in the work with support measures for students in need of special support. And the mapping also shows that many students with disabilities have had extensive difficulties in adequately accessing distance education. On the one hand, both school authorities and principals report a positive view that certain groups of students who previously had low attendance or difficulties with in-person education had increased their attendance or became more engaged in distance learning. On the other hand, it was also pointed out that other student groups who had already had a low attendance or difficulties with in-person education had encountered even greater difficulties with the transition to distance learning. And different surveys conducted by the civil society confirmed these findings. Sweden's student unions conducted a large survey answered by 7,900 students in upper secondary schools. That were the schools that were closed down in Sweden. And almost 40% of students with need of special support answered that the support given didn't work well at all during the spring 2020. The Swedish Disability Rights Federation, we conducted our own survey in the summer of 2020, and the survey had 1,200 respondents, and we also asked questions about education. For example, education had been missed. Studying remotely does not suit everyone, and support one was entitled to before and usually received have been lacking. 44% of people over 18 years old felt that their education had been negatively affected, and more than 1 in 4 parents reported that their children's school and education had been negatively affected during the pandemic. 19% of parents of children with support needs felt that their child's education had been negatively affected also. Autism Sweden reports that remote learning had given increased opportunities primarily for older youth, but for the entire group of students with autism, school absenteeism had, on the contrary, increased during the pandemic. And the Swedish National Association for Attention Disorders also conducted a survey that indicates that many students with NPF, neurodevelopmental disorders, had a tough time in school during the pandemic. 58% felt that school, preschool, after-school care had been affected by the pandemic. And the 4 main areas that had been perceived to have deteriorated the most were difficulties with distance learning, lack of NPF, of adaptations for the students, and lack of support and increased school absence. At the same time, there seems to be a small group of students who had a better study situation with distance education. In their analysis, the Swedish Agency for Participation concludes that the pandemic created an educational debt with major social challenges, and that the pandemic's impact have created an educational debt that gives uneven outcomes for different students. So students who already experienced challenges in their educational situation before the pandemic are at risk of being hit hardest. And that increases the risk also of poorer grades, more premature school dropouts, and an increased influx into the group of young people who need to work nor study. And that's a group that is growing here in Sweden. And what needs to be done then? Do I have some time left here, or am I running late?
1 minute.
Oh my God, I don't know what to do with that minute. Well, I can say one thing then when it comes to recommendations. The role of stakeholders, including staff, students with disabilities in all ages, parents, and the disability rights movement must be involved in the crisis preparedness planning, also regarding the aspects of school and education. Let me say something short about the labor market then. Unemployment in Sweden rose, of course, sharply, just like everywhere else during the pandemic, and young people were particularly affected. And now Statistics Sweden states that despite the uncertain economic situation, the job market was robust in 2022 and thus has recovered after the pandemic. However, the employment rate among people with disabilities has decreased in recent years, partly as an effect of the pandemic. In 2020, the employment rate for people with disabilities was 67%. For 2022, it is down to 52%. So it's a huge difference. And the corresponding percentage in the population as a whole was 77% 2020 and 81% 2022. So that goes in the opposite direction. And people that lost their jobs, they also faced obstacles and challenges when it comes to working from home or participating in remote work. And we still don't know much about the long-term effects of remote work and how it affects the situation for people with disabilities in Sweden. However, there is a very interesting research project underway in a collaboration between the University of Gothenburg, Malmö University, and RISE Research Institute of Sweden. I can put a link in the chat later on about that. And I want to say now, as the end, in the end, and that in summary, we need to know more about the effects of the pandemic on people with disabilities when it comes to the right to work, and the involvement of people with disabilities in the crisis preparedness planning, also regarding aspects of work and the labor market, can't be stressed enough. It is also very important to consider both the benefits and the drawbacks of remote work for people with disabilities when implementing policies and programs related to remote work. Moreover, we see a strong connection between the educational depth mentioned earlier and young people with disabilities who are neither studying nor working, a group that has increased after the pandemic. The work in this area needs to involve many different actors, such as the disability rights movement, schools, municipalities, and the Swedish Employment Service. Well, I think I'm done then. Thank you so much.
Thank you, Monica. It was fascinating to hear about the situation in Sweden. I mean, Sweden is so often provided as a leading example of defending disability rights, of implementing cutting-edge disability policies, but we see how many problems there are on the ground. And the problems that we see elsewhere, we also see them in Sweden as well. This disintegration of supports, different types of supports that happened everywhere basically, and that the result was the increase in already existing barriers and inequalities. Now I would like to open the floor for questions. I see that there are one comment in the chat and also one question. I'll first read out the comment. It's from Stephanie Woolley, and she says, "Thank you, Elaine, and thanks to your interpreter for your sharing of these very poignant aspects of our experiences. Indeed, here in France, one positive outcome of the pandemic has been the big increase in the use of sign language on television, particularly concerning public announcements and the news, which had been demanded for a long time, along with other attempts at accessible communication of information for us. This also led to the attention of the general public about the importance of this need. We must ensure the steps ahead continue and go further, as you say. Thank you again." Elaine, would you like to respond to this comment? It seems that it's really a positive thing that has emerged out of the situation during COVID.
That would be right. Thank you for your response. Yes, it is a positive, but there was also a negative, because the filming crew did not know how to film with the interpreter present. So we were missing out on critical crisis information because of the way that it was filmed. Yes, there was inclusion, but it was not 100%, because before the signing would finish, they would move away the camera, forgetting that the interpreter was there providing information. But yes, overall, it was a positive. However, after COVID, it stopped. We do not see interpreters on the news again.
Thank you, Elaine. There is a question from the European Network on Users and Survivors of Psychiatry. What is the reason that the rate of employment is decreased even after the pandemic? I guess this question goes to Monica.
I think that first of all, I want to say that the figures from 2020 is could be like a bit, maybe they didn't really capture the big lack of work or the big problems when it came to work during the beginning of the year. But there is also major changes being done at the Swedish Public Employment Service in Sweden, in the form of reduced funding, digitalization, distance, other things as well. And they say themselves that all these things have a significant consequences on the agency's ability to identify and register disabilities. And it's interesting that the number of first-time registered young people with disabilities at the Swedish Public Employment Service has decreased in recent years, and especially after the pandemic. And that could be a symptom of that, the feeling of that it's not much point registering because you don't get that much help anyway. So that could be one reason of deployment rate decreasing. And it's also the case that a lot of people that with disabilities that lost their jobs during the pandemic might not get them back. So there are other people that go back into the labor market right now. And we also see that one other symptom is that people that have been long-term unemployed for a long time, more than 12 months, the amount of people that have been unemployed for that long is increasing actually, but that's not true for the people that has been unemployed for a very long time. That group is growing. So we need to know, yeah, as I said, we really need to know more about the effects on the labor market for people with disabilities and what needs to be done. But it is a huge problem, and we work a lot about that, with that issue right now from the organization.
Yeah, once you're out, it seems very difficult to get in, especially when there are so many barriers to different barriers to employment for people with different types of impairments. Paolo, do you observe similar dynamic in Italy?
Yeah, I could say so. In Italy, firstly, we have some problems with data gathering with reference to labor markets, because the law number 68 of 1999 provides that the government have to deliver a report every year, but the last report delivered in 2021 was updated until 2018, I think. So we don't have new data about the post-pandemic period. And the data regarding the labor market in Italy are a bit difficult to interpret. We have a very strange labor market dynamic in these months, and the rate of persons with disabilities employed had an increasing rate, and last month was getting worse, but I don't know precisely why.
Yeah, I mean, it makes sense. If you don't have data or you don't have reliable data, then it's very difficult to make comments or to discuss what's happening. You don't actually know. This goes back to this one of the recommendations in the morning session, to have more and better and disaggregated data on disability, which would enable not only policy developments but also advocacy efforts. So our time, the time for the session is now up. I thank you, the three of you, very much for your contributions. And I also thank the people who posted comments and questions in the chat. So now we have a 15-minute break.
If I may, I may.
Yep.
Just one more comment regarding information on Twitter. European research for people with disability and employment. Ireland is the worst for people with disability in employment. That is our evidence. So when we say people with disability, we'll also include deaf people in that. That's on Twitter.
Okay, thanks, Elaine, for this addition. So let's have a break now. We have to be back at 2:45. Thank you again.
Thank
Thank
you.
you.
Bye.